Hello, my name is Marnie Kramer-Kile, and I'd like to welcome you to my online pharmacology course. For those of you who don't know me or haven't met me yet through some of my work, I'm a nurse educator. I've been a registered nurse for 20 years. 15 of those years have been spent in undergraduate nursing education. And up until this year, I've still been in practice, part-time and casual status. My background is in adult health, particularly in critical care settings. I'm a general systems ICU nurse. I created this online pharmacology course out of the work that I've been doing with repeat writers for the exam. So my specialty is actually in helping remediate repeat writers of both the NCLEX-RN and the previous Canadian Registered Nurse exam that we had in Canada. And my work focuses primarily on the actual NCLEX-RN test plan and looking at different components of that test plan in a way that benefits students towards success. So pharmacology has always been an area of really high anxiety for students. And when you actually look at the NCLEX-RN test plan, pharmacological and parental therapies client need area is only around 15% of the exam. However, you do have to demonstrate proficiency within this client need area. And most importantly, in all honesty, pharmacological care is such an important part of our practice. And I do think as registered nurses that we do need to be stronger in our approach to pharmacology. And just even in creating this course, it significantly has improved both my educational and my practice within acute care settings. So I'm hoping that you'll find this course not only helpful for NCLEX-RN success, but that it will also help drive you towards becoming a stronger practitioner as well. But when I look at the NCLEX-RN test plan, and when I go through various practice question resources, and I've been through all of them, thousands of practice questions since I started this work, I see three primary themes that come forward with medications. The first is a focus on serious adverse events. When we study our medications, we need to know not only kind of the weird and wonderful, events that can happen. Like, for example, propofol can turn a patient's urine bright green. I've actually seen that in clinical practice. But looking at, potentially life-threatening adverse events and really thinking about what is it that we have to recognize as nurses to, one, keep our clients safe, and two, to be able to predict, adverse outcomes related to medication therapy. So that's a major section of the exam, our first major section, and you'll see that reflected in the activity statements in the current 2016-2019 NCLEX-RN test plan. The second area, which I even struggle with still, as an experienced practitioner, is in the drug-to-drug interactions. And when you open up a pharmacology textbook and you look at the metabolism section, when we're talking about pharmacokinetics, and you look at the liver and the P450 system, they often have this huge table that has a list of all the different drugs and how they are either inhibited or activated within that system. And a lot of students try to memorize those tables. But really, the key to understanding a drug-to-drug interaction is understanding basic pharmacokinetics. And so what I did over the last year is I actually developed an algorithm to use alongside your practice questions that will help you to work through and predict potential drug-to-drug interaction questions. There are very distinct patterns that come forward in these types of questions when they're constructed. And I've tested this algorithm that I have in this course alongside NCSBN, learning extension questions, UWorld, all the different types, and it works. So I'm excited to show that to you in this course. The third is really looking at relevant aspects of patient teaching. So what are the most important things, that we as nurses need to teach? And often what happens, I find, when graduates are preparing for board exams, like the NCLEX-RN, is that they spend a lot of time, one, studying medications they already know, and two, not studying the medications in the way that they need to know in order to apply the information for the NCLEX. So I take, an example of a patient, a few years ago, comes in to emerge taking, 30 puffs of salbutamol or albuterol, for our American students, and not getting any relief. So, the physicians are looking at increasing the doses of the medications and changing them. But really, the fact of the matter was the patient was not using their medical dose inhaler properly. And so really that is a nursing action, a nursing responsibility, is teaching those aspects of medication administration. Of course, we go a step further. So if a patient comes in and they're using an inhaler 30 times a day, we assess how they're using it. And then if they're using it properly, then we start to look at the other aspects of the medication administration. So we're really going to look at that nursing focus as we move through the course. Now, I engage my learners in active learning, and a lot of NCLEX-RN programs out there allow you to passively learn, and that means that they give you a lot of lectures. They use strategies such as fill in the blank, a lot of practice questions. We're not going to do that in this course. This course is up to you. You are going to really dig into the content. You're going to work through the content within the exercises that I give you, and we're going to do a lot of clinical thinking and applying around this, because the NCLEX-RN is an exam of critical thinking and application. And so I'm going to give you the skills that you need to be successful with that. So what you'll find in each of these units, I've constructed review questions. I went through one of the main pharmacology textbooks, and I went through every single chapter, and I thought of what I would ask students as an educator about those medications. And so I have narrowed in and given you review questions that are focusing on the most important aspects of medication therapy. So I ask that you do these review questions. The answers will be provided, but I do really encourage you to do the work and use your pharmacology textbook. I also think that you should study pharmacology alongside disease, the disease that it's used to treat. And so you'll see that I've linked a lot of different videos within this section to help you understand, diseases like fibromyalgia and how, medication therapy would be used. So I use the Khan Academy Health Sciences section a lot with my students. I think that they provide a really informational approach. So when I think a video will help you, I've linked it in. And then, of course, I've developed practice questions as well, because I want you to start thinking about how an examiner would structure those questions and what the things are that we would focus on. So throughout this pharmacology course, you're going to have little informal videos like this one with me sitting in my office talking about the unit and pulling out key aspects as well. And of course, at any time, if you have any difficulty, please feel free to email me at Marnie@rnstudyguides, that's with an S.ca, and I can respond to your questions as well. So let's work through this together. I wish you the best of luck, and we've got a lot of work to do.